So today we're going to go over the gas and colic routine. This routine is designed to help a baby with any gas buildup, gas bubbles, constipation, and even reflux, because reflux can cause increased pressure, and if there's no space and it's not moving well, that pressure down below will restrict how much can come through, and that pressure buildup in between those can cause a little bit more reflux, gas, burping to occur. So the first thing we always do when we're providing massage to any infant or child is ask for permission. We use resting hands and say, "Hello, baby. Can I give you a massage?" And we look for any affirmation, any cooing. We don't want distress. If a baby's distress, it's not a good time for massage. When we think about our hand placement, we want to use the bottom half to third of our hands, and we're going to come and use a broad stroke starting just below where the sternum is, starting just below, right at that belly line, providing pressure downward. It's a gentle pressure. This isn't deep. And you're going to alternate hands, bringing that bottom of that hand down and through, down and through. This is to help create a downward pressure. That downward pressure can help move any gas bubbles through the stomach and help the baby's digestion. So 30 seconds to a minute. If the baby likes it, you can keep going, or we can move on to our next technique, which uses the legs to provide some compression, bringing the knees towards the chest, rocking the pelvis backwards, and then when we come out, we're going to give a little wiggle of those legs just to help promote relaxation of the abdomen. So pressure on the abdomen, we're going to hold for 3, 4, 5, 6 to 10 seconds with this. Feel like they need a little bit more of a hold, or they respond positively to the hold, you can do a little bit longer or a little bit shorter. But if we start with 6 and work our way up, we can shake things out. When we do this, we're creating pressure in the abdomen. The baby might fart, the baby might poop. All of those things are normal and perfectly fine for this motion. So once we hold for 6, we bring down. And we're just going to go through 5 or 6 repetitions up here. This isn't a routine that's designed to take a lot of time. And we'll do one more here. 4, 5, 6, and then coming down, shaking things out. You may wonder why my baby has a clock on it. We're going to look at the digestive tract of the large colon. It follows this path and then out. And so if we think about that path, we can help any buildup, any gas move along that path. So we use 2 hands for this technique. The left hand is going to start at 8 and walk its way around, move all the way through, back to 8 o'clock. The right hand is going to join in after the left passes 12, or past the belly button. And that way you have 2 hands providing pressure. Once the right hand gets to 6, it comes off. That left hand stays on, moving past 12. 6, right hand comes off, past 12. And this is to help the baby with its digestion, moving anything that's stuck or not moving well, or any gas buildup. A cranky baby who has a lot of gas buildup can be helped a lot by this. And again, the left hand stays on, the right hand goes 12 to 6, just helping that last little bit out. And so that 12 to 6 helps that last little bit. So we're doubling up to help to expel any gas or pressure buildup. The next technique is similar to the one we did just a moment ago, but instead, after the hold, our hold again is for 5, 6 seconds. Instead of wiggling down, we're going to come out and helping down and extending the back a little bit. So when the legs come down, the back's going to extend just a little bit, helping that pelvis tilt. And when that pelvis tilts, that helps that last little bit and getting contraction of those lower abdominal muscles. Babies aren't strong and they don't stretch into extension or laying onto their back. So we're just providing a little bit extra support. 5 or 6 repetitions here. Again, if your baby poops, if your baby farts, all those things are normal and are actually a sign that we're moving things along. Coming down and a little bit extended. We'll do one more for demonstration. Supporting the legs, bringing the knees towards the belly. Holding for 5, 6, 7, 8, 9, up to 10 seconds. Coming down, allowing that extension to occur. And we don't want to just say, all right, baby, you're done. We want to come back to our resting hands and contain the situation, allowing the baby to know we're done with your massage. I hope you enjoyed it. And that is the gas, colic, and reflux routine to help babies move things along. Thank you for watching the gas, colic, and reflux routine. If you would like more information about infant massage or help with infants for a number of issues, including gas, colic, reflux, as well as sleep difficulties and pre and post frenectomy or tongue tie release, you can reach out to me at brian@balancedbabypt.com. I also provide an online course that can teach a number of different strokes, not included in today's video, to help infants grow, develop, and thrive. So you can find me at balancedbabypt.com, and if you have any questions, please reach out. Thank you.